I'm going to start by giving a brief overview of what we are going to be looking at during this breakout session. With the onset of the COVID-19 pandemic, jails and prisons across the country were identified as major concerns for COVID-19 transmission and spread. As a response, law enforcement agencies and other criminal justice related organizations enacted policies to divert people from our jails and prisons. Many nonviolent offenders that would have normally been incarcerated were diverted or released from these facilities for the sake of public health. For many years leading up to COVID-19, advocates have championed criminal justice. In this lesson, we will explore Washtenaw County's current efforts to divert people to the criminal justice system. We will also examine the changes made since COVID-19, how we envision the path towards criminal justice reform moving forward. All right, I'm going to turn it over to our panelists and allow them to give us their names and what they do surrounding criminal justice reform. Lauren, do you want to start?
Sure, thanks, Katie. Hi, everybody. I'm Lauren Velez, and I'm the Director of Services at Avalon Housing. Avalon is a permanent supportive housing provider based in Ann Arbor, but we serve over 800 folks throughout Washtenaw County. We develop, own, and operate affordable housing units, and then we pair those permanently affordable units with support services to wrap around folks and help them transition from homelessness into housing, with the goal towards achieving and maintaining long-term stability. So we work with a lot of folks who have histories with both substance use disorders and criminal justice involvement. A lot of time there is a lot of overlap with both of those things. And, you know, we see firsthand how those things are impacting pretty much all aspects of the lives of the folks that we're serving.
My name is Aaron Suganuma. I am the reentry coordinator for the Washtenaw County Sheriff's Office. I might not give as robust a introduction as Lauren did. The work of Avalon is amazing. The work of the jail is actually pretty cool as well. So the jail sees about 8,000 unique, just over 8,000, I believe, unique individuals each year. Some of those people are here up to 12 times a year or more. And so a lot of the programming that we're going to talk about today is aimed at reducing those numbers, both the intakes on the front end and the amount of people coming back.
Hi, everybody. I'm Lisa Gens. I'm a program administrator at Community Mental Health, and I work with our mental health and public safety millage initiatives, as well as our jail mental health team, our CMH jail mental health team, and our specialty court teams. I'm really excited to be here today speaking with Aaron and Lauren on this topic, so thank you very much.
All right, thank you all. Thanks for being here. So to get started, to get our discussion started, I will start with the questions we can explore. What steps has Washtenaw County taken to divert people from the criminal justice system? What changes were directly enacted due to COVID-19?
I'd be happy to address this first portion of this question. Back in 2017, the Board of Commissioners for Washtenaw County voted us a Stepping Up Initiative community, which means that we were going to address the overrepresentation of individuals with mental health and substance use disorders, finding our way into our criminal justice system. And as the result of that, we did a whole host of law enforcement training, developed the Diversion Council, expanded our mental health crisis team, which is a mobile crisis team that's able to respond to individuals in crisis 24/7. It also led to us putting language on the ballot to continue initiatives related to mental health and criminal justice that resulted in a millage that has resulted in a whole bunch of different initiatives in our community, and I'll put a link in the chat to our millage page that talks about some of the different things that have happened in the last year. But we also did a sequential intercept mapping of our adult system, in which we identified the 5 intercept points in which this population interfaces with the criminal justice system, and helped with identifying evidence-based practices that could be implemented at each of those intervention points to reduce this number of folks, as well as address some of the racial disparities that we're seeing in the criminal justice system as well. As a result of some of that work, we also opened an assessment center for adults to act as an intercept zero diversion strategy, where adults could go in a mental health crisis and get connected to services and create an alternative for law enforcement other than an emergency room setting, which is there to do acute care situations, but that acute care situation usually is just a really brief episode in time and may not result in somebody actually getting connected to treatment despite their best efforts. And then also the alternative pathway in our community, which was to go to the jail, which, though there are a lot of services and supports in the jail, we know that the outcomes for individuals who have mental health or substance use disorder that get entangled in that system, we see increased recidivism, we see really lower outcomes or not as good outcomes as we would like to see. So if we can keep people out of that system altogether, we know that it ends up being a much better result for all people involved. Some of the other things that we did was we also completed a youth sequential intercept mapping that helped us with identifying juvenile justice strategies as well. And one of those is to look at creating a youth assessment center that we're hopeful that we can stand up, hopefully within the next year. The millage helped to fund an RFP to our housing partners in the community to try to establish more crisis-based housing for not only for youth in crisis, but also for adults, because one of the things that we see most frequently from our mobile crisis response team is what underpins a lot of people's drive to crisis is not having adequate and stable housing. And we also have placed mental health professionals on our crisis negotiation team. That is the enhanced team through the sheriff's office and through other law enforcement jurisdictions that will respond to help people in crisis, oftentimes suicidal individuals who may be barricaded in their homes. Our mental health professionals provide that mental health specific lens, as well as connection to support and treatment services for that entity. And some of the things that we've seen post-COVID, and I'll hand it over to my partners from there, is law enforcement really reaching out to our mobile crisis teams for increased co-response. I think not only, I don't know if COVID was necessarily the driver for that, or some of these really horrible things that we've seen happen in our community as law enforcement have interfaced with individuals, oftentimes in crisis, or individuals of color, and they have been asking for increased co-response from our crisis team, which is fantastic. So that is one of the things that we've definitely seen post-COVID. Lauren and Aaron?
So I'll piggyback a little bit off of some of the work that you were just talking about, Lisa. So I put in the chat box something called the sequential intercept model, and so that's one place that we can start to take a look at and put into context of some of the work, a lot of the work that Lisa's talking about, and some of the work that we're going to be talking about, all of us. Basically what the sequential intercept model is this idea that, I mean, I think about it like almost like the criminal justice system as being like a highway. And as one of the things that Lisa was talking about, the longer kind of somebody is in that highway, being exposed to jail, potentially prison, incarceration in general, it's a very traumatizing space. A lot of people's real needs don't actually get addressed. Even, you know, try to think about doing a therapy group or creating a therapeutic session in what is generally an antisocial environment, such as a carceral setting. It's just not the ideal place for something like that. And so we try to take a look at off-ramps where people can get off of that kind of that highway as soon as possible. So a lot of the work that Lisa was just referring to was things that are community-based, interventions where maybe people had an initial contact with law enforcement or maybe dispatch was called, but as we will talk about later in this discussion, just trying to figure out how can we get more appropriate interventions to people sooner in the process. That's a big part of the work, that COVID helped to usher in. Now, in terms of what the jail is actually doing, the jail has actually been, a leader when it comes to the protocols that were developed to help manage the spread of coronavirus in the jail or in the carceral setting. As has been widely discussed in the Free Press by Angie Jackson. She's done some great articles about the MDOC. Washtenaw County has only had one outbreak in the jail. It was from an outside vendor, and it was back in May. Since then, beyond the quarantine section, there have been no cases of COVID. And a lot of work has gone into creating that environment. Now, beyond that, other stuff that's happening within the jail, and this is across the board, is a lot of people, so we're really restricting outside vendors coming in. So one of the things that Washtenaw County has spent a lot of time doing over the past 6 or 7 years, I think especially, is kind of, the word my boss uses for it is how can we blow up the system and rebuild something better? And so bringing in better, more appropriate programming. So for instance, we had something like 34 different programs that were running pre-COVID. Right now, we've got some of those programs still going, but we've got a lot more than a lot of other county jails I'm talking to. We've got a full community mental health team working with people who are mental health consumers outside, for CMH consumers outside, but also people who just generally have mental health concerns while they're in the jail. Who aren't necessarily CMH eligible. We're doing GED support, we're doing special education IEPs, we've got Washtenaw Literacy delivering program, Dawn Farm is doing substance abuse programming in the jail, and then we're coordinating with both Dawn Farm and Home and Envision for aftercare. We've also got MRT in here doing some work. And so we're doing everything that we can to continue to engage people while they're in. We just got notice that we've been awarded the funding to start an MOUD program. We've been doing Vivitrol in the jail, so this is going to expand also to Suboxone and methadone for in the jail as well as community-based. But there's been a huge effort to just divert people away from the jail. To put things in perspective, the average daily population at the jail pre-COVID was up around 350. Since COVID, the jail did everything that it could to network with local law enforcement to talk about the way that street level policing is done and the people who are brought to the jail, and working with the courts, talk about the people who are staying in the jail. So there's been a lot done to divert people away in the first place, a lot done to issue and increase the use of personal recognizance bonds so that people can get out without cash bail. And then increase the use of community corrections and electronic supervision. So whereas before the population was up around 350, now we've averaged 160 or less. And ideally that will be something that is ongoing, and more on that later. Lauren?
Thanks, Aaron. I would like to, just raise up that while overwhelmingly this pandemic has been an absolute nightmare and travesty, it has also shown us that we can do things that we have long talked about and not acted on because of various different roadblocks that we've brought up and reasons why we couldn't do something as quickly. But we've seen that we can get financial assistance to people rather quickly. We've seen that we can get people out of jail sooner. And that when we're kind of like held to the fire and forced to make these changes, we can make them. And so I think that is one kind of silver lining that we've seen that. And we can get people housed more quickly as well, with the right resources in place. So we have Avalon received a grant to provide rapid rehousing for 50 individuals in our county, which was a huge boost to the program. We're getting 50 more people housed in a very short period of time, with assistance for up to a year, both rental assistance and support coordination, case management services. And then it's also highlighted how absolutely crucial housing is for folks, and that we really need more affordable housing options that are accessible to folks who have all types of backgrounds. And, you know, we really see when we go to start housing people how those collateral consequences of incarceration and law enforcement involvement impact people's ability to find and maintain stable housing, find employment, and things like that.
All right, great. Thank you all. These are all, you know, great examples of what is being implemented in the community and what Washtenaw County is, you know, programs that are getting ready to be launched. So with that being said, we know that we have quite a few agencies that have worked together to reform our diversion practices here in Washtenaw County. However, some agencies are less supportive. How can we better align all of our law enforcement agencies to promote diversion from the criminal justice system?
And I think a lot of it starts with, you know, communication and collaboration. You know, I think we, you know, we need to make sure that officers have the right tools in their toolkit to be able to respond to the multitude of things that they're asked to respond to currently. And so I think part of it is training and information and support, but also I think we need to start really, you know, focusing our efforts towards those prevention elements, those elements of building healthy and sustainable communities that involve so many other things regarding quality of life, and making sure that those things are available to folks, like housing, employment, access to education, free and quality education, all of those things that help us with creating a community that we all want to participate in. And by doing those things, we can really eliminate some of the need for law enforcement to respond to some things that I don't know if law enforcement really have the tools to be able to properly respond. So we not only need to give them the tools, but I think we also need to focus our efforts on really some of those prevention efforts so that people don't find themselves in crisis and in a situation where a system is activated to solve a bunch of issues that it has never been equipped to solve or address.
Yeah, I would not want to oversimplify what is a really intricate and delicate issue and balance here with bringing, you know, different systems together to collaborate and push for change. However, one simple thing is having everybody kind of like in communication and in conversation together. So for the last couple of years, Avalon Housing and CMH and Ann Arbor Police Department have been holding bi-weekly meetings with the community engagement officers, and then also some, you know, the police chief and different sergeants, so that we can talk about what's going on in our community, the folks that we're all interfacing with, that we all have, you know, mutual clients, if you will, or folks that we're all working with, looking for ways that we can collaborate just to create safer spaces that are more trauma informed, that will get a better result for you know, the greater goal of safer communities and strengthened communities. And I think that when we're able to like literally sit at a table or on a Zoom call with one another, you can get to know people better, you can get to know agencies better. I certainly think that, you know, at some level, like a base level, you know, law enforcement probably has a preconceived notion of like social workers, and social workers are going to have a preconceived notion of law enforcement and what we're there for. And it can seem like we've got a lot of competing needs and goals. But when but when we're all coming together, I think we're much better able to see where those similarities are and where those shared goals are, and how we can be creative and learn to trust each other to find ways to move towards those things.
Yeah, and there's nothing, you know, that increased dialogue, that connection is so important. I think that we're really fortunate in this area to have had a lot of collaborations and task force put together where there are all these stakeholders that are put together. And I think not just representing agencies and organizations, but also that have connections with actual people on the ground, people who are the consumers, you know, because we just don't want to do top down kind of like design and just assume that something's going to work. We need to be getting feedback. And, you know, and I think that that's something that I've seen that's continues to inspire me and something that I've seen necessitated as we all adapt to, you know, to COVID. It's critical that we all stay updated with each other's operational capacity, you know, if I'm trying to refer somebody to treatment, it's really important that I know that, you know, they're doing a 2-week quarantine at Spera, and that they're doing another phasing at Dawn Farm downtown to be able to get into transitional housing, because it helps to know, you know, what I'm telling the, you know, consumers on this end who have limited access to information. And so, you know, one of the other things that I think is big here, this foundational thing, you know, I'm going to take it back to the initial question, you know, what can we, so I just spoke for people who are already on board. Part of the question was talking about people who aren't necessarily on board. And I think it comes back to a couple things. Like one is messaging. One of the big ones is messaging. And I'll take it back a step farther to say, you know, what's the goal? You know, because the messaging, I think, can get lost in what's the goal. The goal at the end of the day, I think, for everyone, the criminal justice system, it's desistance, it's public safety, you know. But really it's public safety. So I think that the original design behind a lot of what we see in terms of classical criminal justice is, you know, like ruling by the fist, you know, ruling with a stick, you know, do this or else you're going to get punished. You know, you did this, we're going to, eye for an eye, we're going to lock you away. The reality is that we can see, you know, from statistics across the board, when it comes to racial disparities, when it comes to outcomes, it hasn't been effective, right? And so I think if we go back to take a look at what the goal is, which we're given the opportunity to do now, and we've got enough people who are really willing to take a step back and say, okay, we've got this goal, how are we going to reach this goal? You know, maybe we can go around the ways that we've been doing this before and really get creative. I'm seeing more and more of that happening. And as we do that, we're creating models that if we're keeping the right data and you know, taking notes on the way that we're doing things, we can replicate it in other areas, you know. And so the data, the public safety, the numbers, it ends up speaking for itself. All we can do is be a good partner, you know. And I think that it's easy to lose sight of that. A lot of times I think there's a desire just to want to keep things as is. People are so busy, let's just build on the existing system as it is, as opposed to just trying to start over with something new. So I think there's really, like, you know, space to kind of start in the middle, but COVID is a great time to start things from fresh. You know, and here's the other thing about this, you know, criminal justice reform is such a big issue because it appeals to everybody. You know, we're talking about solutions that at the end of the day, they benefit individuals, they benefit families, they benefit communities in terms of public stability and public safety, while generally speaking being more effective when it comes to service redundancy and effective use of taxpayer dollars. You know, and so it's hard to argue with that. And so I think that what we need to take a look at is the messaging, you know, and this is one of these eras, I hope, and I think that I see where the messaging is really changing broadly in terms of public sentiment, you know, because the politicians aren't going to vote for and make the changes, the bold changes that need to get done unless they know that they have the public support. And so that's why I think that forums like this are so important, so we can start to talk about some of the great work and opportunity that's getting done to let people know that there are different ways to be able to do this stuff.
Thank you. And when it comes to the importance of public support, these are all great things that are going to be implemented or have already been implemented to divert people away from jails and prisons. But I think something the public wants to know long-term is, are we seeing more consequences from this? Are people being released from jail too early? Is there an increased rate in crime, increased rate in recidivism? So with that being said, we know that COVID-19 has prompted many jurisdictions to divert individuals out of jails and institutions. So have we seen any negative repercussions that would dissuade our criminal justice system here in Washtenaw County to make these diversion practices permanent?
Should I start this time? Okay. So, yes, so I'm glad that you asked that, because, so what are we talking about here? So one of the things that we're talking about here is, there's the numbers that I mentioned earlier. The old operational norm was about 350. Now we're down around 150, 160. It's been lower. I think it was down to almost like 125 at one point. So how did we get there? We got there through really intentional dialogue with the courts, through really intentional dialogue with law enforcement, the law enforcement agencies who refer people to the jail, to really, say, driving offenses, really low level things. People don't need to be in jail. Well, where's the proof in that? Okay. How about this? So there were 89 early releases. Classically, let me back it up again. So looking at statistics from the jail, I wish I could paste in a link. I don't, anyway, maybe I'll get it in a couple, while someone else is talking here in a minute. Traditionally, the recidivism rate at the jail tends to be around in the mid 60s, 63, 65%. At one point, I've also seen numbers where it's in the 50%. Right now, what we're looking at is that 89 people were specifically given early releases as a result of COVID. Since then, all but 17 have stayed out of the jail. So 17 out of 89 people, that's a 19% recidivism rate. That kind of beats, it's a couple things. It beats that classical recidivism rate, but it also points to something else, which is, why were all those people in the jail in the first place? And that's kind of the bottom line. If we're not seeing a great spike in crime, there's always a spike in crime when it comes to the summer. That's a nationwide trend. But given what's going on with the economy, given what's going on in terms of the state of the nation, we haven't seen kind of the kind of like an according kind of rate, alarming rise in crime, and so what we have now is we've got 160 people at the jail. 80+% of those people are here for assaultive crimes, or are here because they've got multiple and severe parole and probation violations. I think that in short, what I'm trying to say is that the evidence seems to speak for itself that something is working better now. Another thing that I'll point to in terms of sustainability is that this Sheriff Clayton, sat on the governor's task force for pretrial detention, incarceration, and diversion. That task force came up with a list of 18 different policy recommendations to help keep jail populations low and divert people away from the criminal justice system. I'm going to post a link to that in the chat here as well. But that is to say that this sheriff, and under his administration, our goal is to keep the operational level low, as long as it serves the safety of the community. We feel that we're doing the taxpayers a service, as well as ideally massively benefiting the safety and stability of the community. So.
Awkward, like Zoom, who's going to talk? So I just wanted to share that at one point, AAPD had shared with us that crime was down locally by 53%. Now, I'm sure some of that was attributed to like folks just kind of staying in and staying home and not being out and about as much. However, you know, at the same time, we're seeing that we did have these folks that were released early from jail, and we still saw over 50% reduction in the crime rates during this pandemic period, which is like hugely substantial. And then in thinking about the folks that were released, of those 89 people, you know, we have an opportunity and I think obligation to be looking at what's made the folks successful that have stayed out of jail and have not, you know, experienced recidivism. And then for that small percentage, that, you know, 19% or so, what happened with them. And I think that if we took a cold hard look at that, the answer is not going to be like, oh, they got out too early, you know, they needed more time in jail. Like, that's not going to be the solution, right? So I think that we have an opportunity to kind of like examine that. And, you know, I know we are, but just, I guess that's a long way of saying that, no, we haven't seen the negative consequences associated with folks being released early and things like that.
Yeah, I was just gonna add that the Diversion Council really wants to look at what some of those, you know, correlating factors are and how we can keep, you know, this COVID era low numbers, community-based, you know, treatment and care moving forward. So I think it'll be exciting to see what comes out of that exploration as well.
All right, thank you for those answers. This next question, I know we mentioned this earlier and we can't possibly, you know, go into as much detail as we need to in the next few minutes, short few minutes that we have. And Adrienne Waller touched on this in her keynote presentation this morning, but there is a 6-time higher rate of incarceration for drug charges for Black people in the United States, despite the same rate of substance use. Washtenaw County has deep racial inequities that have created various harms to individuals and their communities. What needs to change locally to address this?
What?
No, I'll go ahead. You know, I think this is such a question, and I don't think, you know, Lauren, Aaron, or I have the answers to unweave all of this. There's so many elements that are in play here, and I hope we can, you know, talk about this and dig into this much further and all the work that we're doing in our sectors to really continue the momentum of addressing this in a very obviously thoughtful and constructive way to really change our systems for the better. But with that, I will bring up one strategy that is being utilized that I think will help in this space, which is the Law Enforcement Assisted Diversion Initiative. It was an initiative that was developed out of King County in Seattle. That was specifically to address this exact issue, which is the racial disparities in the low-level drug offenses that were filling up their jail so much so that they were looking to build an entire new facility. And instead, the community really called for a new approach to doing this, which was to connect individuals to treatment instead of to the criminal justice system. So the program really trains law enforcement officers to connect individuals to a treatment provider that rapidly responds to the scene to help get that individual engaged and connected in treatment resources. And then the prosecutor really holds you know, a report is still written, but holds the charges and does not charge that individual as long as they follow through with treatment. But it's a very low level, low barrier, treatment approach, very harm reduction focused. So it's as simple as following through with an assessment, and the prosecutor will get rid of the charges. So we are going to be standing up a program here in Washtenaw County, a lead program. We have put together an implementation working group that was just started working together in January, as well as we are receiving support from the LEAD Support Bureau, one of 15 communities across the United States to receive this increased support to implement our program here. We just had our new prosecutor, Ellie Sabat, as of a couple weeks ago, is joining our team. It is a team made up of community mental health, our sheriff's office partners, the public defender's office, and the prosecutor's office. So we're really hopeful that we can implement this program to address those exact issues here in Washtenaw County. Again, just a small slice, but we're also hoping to catalyze this new training that we're going to have to provide for officers to know how to, enact these diversion efforts for both of youth in our community as well as adults, to really connect people to resources instead of the criminal justice system when we're trying to deal with issues related to mental health and substance use disorders.
I would add that, we live in a wonderfully progressive county that is, open to trying and exploring a lot of new things. And we also live in a deeply segregated community. And that is something that, I think we really need to tackle, and we need more affordable housing options that are accessible to folks across, the county, all throughout the county. Those options are really limited to specific certain areas for folks. And as you mentioned, Katie, we know that the consequences are really different for folks of color versus, white folks when we're looking at the same crime sometimes, particularly, when it comes to drug-related crimes and mental health. And that is like glaringly obvious when we're looking at the legalization of marijuana and like all of these new shops that are popping up that are like owned by white proprietors. Well, we've still got like a whole lot of Black folks that are sitting in jail for, weed related crimes. So there's a big disconnect there. And, again, like, going back to like the housing opportunities and things like that, when we're seeing folks that have more of a criminal history, more engagement with law enforcement, it is harder for them to find housing. It is harder for them to find employment. And, Aaron mentioned earlier this morning that like housing is a big deal, and I don't think we can like say that enough. Housing is healthcare, housing is diversion, housing is prevention. And that is not something that is accessible and available to everyone in our community.
Yeah, as a result of COVID, a lot of the housing partners really joined together to allow individuals who were homeless or precariously housed to be able to adhere to the stay home, stay safe order by maintaining the warming centers throughout the community and establishing additional sites through Red Roof Inn Motel, for instance. And we really saw in real time the impact of the housing first model and giving people that rapid access to a safe place to stay. Just that roof over the head and having a phone, and how many of those individuals were then able to be permanently housed as a result. It's a significant impact that, this horrible COVID situation has been able to provide our community. But it was through those collaborations, thinking outside of the box, the, quick access to some funds that allowed that to happen. And we're seeing the benefits of that now.
Yeah. So I wanted to pause on that. It really is. It's a massive question. Housing is a huge, how many hours do we have to talk about? How many days, how many weeks or years do we have to talk about this? Racial disparities in the criminal justice system, the collateral consequences of incarceration, the intergenerational trauma that has led here and continues to be perpetuated are massive issues. And it's not something that we can just snap our fingers and undo or snap our fingers and change. But I think that what I'd like to believe is that we're in the midst of change. There was a recent report that was put out highlighting the racial disparities that have been found in the Washtenaw Criminal Justice Report I threw that link in the chat if anybody's interested in checking it out. We have a racial equity officer who I think is going to be very busy. But fortunately, I think that she's got a lot of allies. It's just such a massive issue. We can start talking about other social determinants of health, but race is one of these things that is just, it's a glaring commonality that is very disparate. I think that the demographics of Washtenaw County is that it's 13% African American, I believe. But what we've got here is that inmates who identify as Black, African American, or white account for 86% of the inmate population at the jail, 39% of the people who are booked into the jail. I don't have the stat right off the top of my head, but those are people who are booked in. A lot more of the white individuals who identify as white are able to then get bonded and get out. And the actual population of people who are African American and remain in the jail remains higher. It's things like this that we're really taking a look at. What's feeding this? What's perpetuating this? And what can be done about it? What do I say? I will say this, data matters, personal stories matter, messaging in the community matters, opportunities matter. Something that I hit in the other section that I need to just hop on the soapbox for a minute to talk about is the need for community-based services. Before COVID happened, I know that a lot of providers were stretched thin in terms of trying to, even provide the most basic services that they were committed to providing. But then COVID hit, and all these folks, basically came out and said, we're in crisis. This is like the highest time ever, I think, in terms of utilization of mental health services, which is great that people are utilizing, but those tend to be underutilized services. So what does that mean for the general state of the public? The reality is that we need, especially as we're talking about diversion from the criminal justice system, we're talking about decarceration. We need to move and demand more funding and support for community-based services. Services tend to be underfunded, understaffed. There might be stimulus funding that's out there that have launched some great pilots, but everybody's looking at these things that says, what happens when this funding runs out? What happens when the reality, comes, which is, maybe another panel where, the stimulus money runs out and tax rolls are down. How are we going to keep things going?
By voting.
Yeah, this is a long-term thing. But, that being said, one of the other things that we need to take a look at too is, if we're moving to a different system as we develop new systems, not relying on the criminal justice system necessarily or incarceration especially, doing what we can to bolster our community-based providers so that they're better equipped to work with the new and evolving realities, more acute realities probably of the people who are coming in for services. That's all I got.
Thank you all. We have about 15 minutes left. I want to make sure we save time for questions and answers, and also save some time to talk about what the next steps are moving forward. But let's talk about the health aspect for a minute. What role do social determinants of health play in criminal justice diversion? How can our typical criminal justice and law enforcement organizations help address social determinants of health?
I don't want to go first. I guess I'm going. I unmuted myself. It is what it is. It's like,
This is you, yeah.
I'm I'm going to step on the stage, I'll step off. But basically, you know, again, we can make assumptions on where the problems are, or rather, I should say, the opportunities are. You know, but I think that a lot of work needs to happen that is community-based, that is looking at, you know, early childhood development, what we can do in the schools. I think that I can say that an informal survey was done at the jail for the people who are being brought in now and staying in the jail, and the incidence of people who have a history of IEPs and special education is just way up there. You know, the ability for people to be able to communicate, to be able to better put in perspective, you know, what's going on with them. It's playing, I think, a big role in why people are coming to jail. And so I'm not alone in boosting the availability of trauma-informed care, doing what we can to help folks with better communication skills, better coping skills, self-regulation skills, and you know, and I'm going to touch on something else that Lauren mentioned earlier. You know, when we talk about race, when we talk about socioeconomics, just the blinding overrepresentation of folks with those characteristics in the criminal justice system. You know, what does that end up saying to the community? You know, one of the things that I try to explain to people who have not been in a jail or a prison before is that often what you see is people coming to a jail and seeing their neighborhood there. You know, it's either people go in and they know nobody, or people go in and they know everybody. And that's a problem, you know. The reality is that a lot of people are growing up to believe that certain things are not possible, you know, and that true participation is not possible. You know, and I think that there's a lot that we can do to start to address some of those base issues and opportunities for people. But I won't rattle on too much. I'll let other folks talk.
I
Yeah.
say
Oh,
that,
go ahead.
I'm sorry. Now we all
No,
want
go ahead. I know, right?
I would say, again, like at a really base level, the criminal justice system and law enforcement can, you know, help address social determinants of health by collaborating with other agencies and other folks in the community, and really being willing to listen to and learn from the folks who, you know, whose job it is to understand how mental health presents and how these things show up, and when there's a crisis, how that's impacting mental health, and how trauma impacts mental health, and how substance use impacts how people respond to different situations, and things like that. So, you know, bringing people to the table who've like built their careers on working with this population from a different angle, I think would be, you know, maybe the simplest and most effective and impactful way for law enforcement and criminal justice organizations to kind of like help combat some of these things. And then I think also that we really need to be looking at this from a multi-pronged approach. So we need to be looking at people, you know, and I mean that in a multitude of different ways. So looking at how all of these things are impacting one another, right? But then also looking at people who are in the criminal justice system and what has brought them there, what's keeping them there, what we're offering them while we have them in the criminal justice system, how are they moving through court, what are we offering them while they're incarcerated, how are we supporting them post-involvement, how are the things that we're putting in place, you know, from their criminal record, how is that impacting their ability to move forward with life, to how are we supporting them when they are released from incarceration, and how are we setting them up for success, instead of kind of, you know, leaving folks in a situation where maybe their only option is to reoffend to get their needs met, or, you know, maybe they have not addressed those core issues and those root issues of substance use and mental health, and they haven't dealt with those things. So it's like, you know, you put a Band-Aid on the problem, and not a very good one. So, you know, what we're doing for people when they're engaged in the system, how we're setting them up for success once they're being exited from the system, but then also what are we doing on a preventive level? How are we offering, you know, education, not just to the community, but to our agencies, our partner agencies, to law enforcement. And I think in particular, it'd be really remiss if we didn't talk about the need to engage, educate, and uphold, you know, young Black men, looking at who is coming into the system, who is most likely to be engaging with this system and not, you know, having had their needs met. How can we engage that population? How can we support them? And then, you know, also educate, elevate, and uplift them.
Thank you. It looks like we have about 10 minutes left. If you have any questions, you can enter them into the chat box or raise your hand. And I'll give everybody a few minutes to do that. And while you're doing that, let's talk about, you know, what are the next steps here in Washtenaw County? Are there any preliminary plans in place? We've talked a lot about what needs to happen, what changes need to be made. So given our current progress in criminal justice diversion here in Washtenaw County, what are the foreseeable next steps on our journey?
So I think we need, from a systems level, to continue the work and of implementing some of those mapping strategies that were identified from the youth and adult mapping. So continuing some of that work. I think we've seen also to, you know, as a result of increased co-response with law enforcement during these COVID times. We've had a meeting already with the Sheriff's Office to discuss actually creating, you know, 24/7 teams with law enforcement and a mental health professional, always co-responding with each other, doing dispatch 911 training to ensure that the right professionals are called to the right issues in our community. Creating diversion options for youth, I think, is huge. When we did our youth mapping, we did not have a lot of, any sort of intercept zero diversion options for youth in our community. And how can we equip our schools to be able to properly know how to identify mental health issues and get youth connected to supports, so that this doesn't end up becoming an issue related to, you know, truancy and school involvement, and then law enforcement's involved, et cetera, as well as substance use. We need to ensure that there's other options in our community. It's already you know, written into the law that law enforcement can choose to divert a youth that they encounter in our community to either their family or to a system or a service provider that can support that youth and never move forward with a charge. We need to make sure that those options are readily available in our community. And I feel very strongly that hopefully with some of the work of the Diversion Council and with the millage initiatives that we'll be able to stand up a youth assessment center fairly soon. I think the work of the CARES team and the millage funded mental health access for everyone in Washtenaw County is also a huge game changer for our community, for people to get access to supports and get connected. You know, I have not only helped loved ones who have found themselves in mental health crises, but community members who have found themselves in mental health crises, and trying to navigate that system can be incredibly difficult, and that needs to be simplified. We need to help with stigma reduction and recognizing that, you know, mental health is part of our overall health. And we need to be able to have access to those services for our overall wellness and community wellness. So, you know, check out that millage link that I provided in the chat for sure, and to see some of the work that we're doing to continue these efforts. But yeah, I think a lot of exciting momentum is happening.
I want to take like 60 seconds to just also say that I think one really huge opportunity for us to examine our impact and and really improve communication and how the system is working is between mental health and substance use. So we know that we have so many folks who have co-occurring disorders, and that oftentimes substance use and mental health are going hand in hand, but we see so many people ping-ponging between those two systems and being kind of like diverted from substance use because they need to get their mental health treatment in line first, or vice versa. And then I think in that gap is where a lot of the resulting behaviors are leading to law enforcement involvement. And if we can maybe like bolster that collaboration for folks, we might be able to see some really impactful change. And then just one other thing I don't want us to lose sight of is that we've learned in this pandemic period that like we can get done. Like we can find funding for what we really want to prioritize. We can find ways to collaborate and improve and change systems, and to do it quickly. And I hope that if we take anything from this, it's that like we don't need a crisis to be able to move forward. We've learned from one that we can quickly, and I hope that we keep that mentality moving forward.
Yeah, I agree. You know, it's forward progress, and you know, and I think it's going to take a community, and just that, you know, it's a community. We can't all just be individuals. Just saying, you know, I wish things were a certain way. You know, I've seen a lot of people just getting out and getting really active. I was blown away at one of the prosecutors' forums, one of the first ones, where I mean, I think it was hosted by the Washtenaw County Dumps. There must have been 300 people or something like that in that room. A lot of people are really engaged in this issue, which is good. But again, you know, criminal justice, it's almost like a back end kind of thing. What can we do to address things, you know, earlier on? We've got some really cool stuff planned when it comes to the reentry initiative, some housing program that the sheriff's office is going to be putting on, a case management system I'm particularly excited about. You know, and to be really specific, we've heard about programs like Cahoots and some of these other programs where, you know, different service providers are embedded within law enforcement, first responders. That's what, you know, Lisa's talking about when it comes to this lead stuff. It's really exciting work that will help people get more appropriate care sooner and make more, maybe more appropriate contact in the first place to have a better experience. So one of the other things that, you know, I always like to hit on is that a lot of people make the assumption that policy is made only in Washington, D.C. and Lansing. It's not the case. Well, it is. What we can do to impact private business, whether it's through hiring practices or talking to, for people who rent or know people who own property, just seeing what we can do to just have these discussions. You know, people, if they have a second, maybe even a third or more chances, eventually, generally speaking, people age out of crime and they want to be doing the right thing. If given the right opportunity, we can do that. But as a community, right, we need to be having these discussions, seeing where the opportunities are, where people can plug in socially, where people can plug in when it comes to employment, when it comes to housing. Like, I feel like right now, like for a person who has a sex offense, there's like a little like a quarter mile block or whatever that people can actually live. And outside of that, people are like completely gated out. You know, one of the questions that was in the chat is, you know, where do you think Ellie is at when it comes to, Ellie Savitt is at when it comes to the oncoming prosecutor? Where is he at when it comes to a lot of these things? He's been out in the community, very active for years, it's my understanding, fielding, you know, where the community's at. He's got a really good sense of that. Right now, he's in Washington, D.C. To pay his respects to Justice Ginsburg, but I also bet that he's out there networking because he's going to be new to the office. The reality with him is that he ran on a lot of great promises, and I think the hope there is that he's going to be building the connections to be able to execute it. Fortunately, you know, as evidenced by the discussion that we're having now, there's a lot of appetite to be able to support that work. So I'm left feeling very optimistic, and so, you know, COVID gave us the push to implement a lot of these criminal justice reforms. I think we've got some great momentum moving forward.
would add to that, Ellie has also put together these like work groups and subgroups with his transition team that are looking at a lot of different areas. So, you know, looking at mental health, looking at substance use, looking at criminal justice reform. And I'm part of one of those teams looking at juvenile justice and the child welfare system. And just even looking at the makeup of that team, it's incredible. It's a lot of, you know, it's people in the prosecutor's office and the court system and other agencies. And it's also like community members. So I do have a lot of hope for Ellie. And from even just like the very beginnings, it seems like he is gonna, you know, walk the walk and not just talk the talk. So.
All right, thank you all. We are officially out of time. I just want to take a moment to thank our panelists and the audience for all of your participation. Please don't forget to check out the links in the chat for additional information. And if there was a breakout session that you were unable to attend, I think they are all being posted on the WHI opioidproject.org website. So feel free to refer to that later on for more information. And thank you all again. This concludes our summit. So thank you for being here.
Thank you, Katie. And thank you, Erin and Lisa. It was an absolute pleasure doing this with you.
Yes, thank you guys so much.